Prostate cancer, if caught early, has long been hailed as one of the most slow-moving and containable forms of cancers there is. And now a new study in the New England Journal of Medicine is bringing even more reassurance to men affected by early prostate cancer. Whether they opt for radiation, surgery, or no treatment at all, there's no significant difference in their risk of dying of prostate cancer in the next 10 years. And their overall risk is very low, less than 1%. The new study is the first to compare all three options head-to-head. The WSJ's Melinda Beck reports that men who simply monitored their cancer were about twice as likely to have it progress than those who had radiation or surgery. But the overall numbers were again small, 1 in 5 compared to 1 in 10. And there was no significant difference in the risk of death during an average of 10 years of follow-up. Quote, "It's a lot lower than we anticipated irrespective of the treatment. It may be that at 15 or 20 years there is a difference in survival. We need more time to get to the final chapter," unquote. That's according to Freddie Hamdy, a professor of urology at the University of Oxford and the study's chief investigator. Radiologists have debated for years over which treatment is better, and there's growing support for simply monitoring early-stage prostate cancers instead because they tend to be slow-growing and due to the side effects of the treatments. Men who had surgery had significantly higher rates of sexual and urinary problems, while those who had radiation had more problems with bowel function, according to a second study from the trial. Prostate cancer is the second most common cancer among men, after skin cancer. An estimated 180,890 men will be diagnosed with it in the U.S. this year, and some 26,120 will die from it.